Hello to all the viewers. So with me, I have a tremendous rank achiever, Dr. Remya, rank 14 in the NEET medical group exam. Well, Remya needs no introduction to me because I have known her for many years. She has done her MBBS from Trivandrum Medical College, and she knows me since then for many years. So, Remya, but on an official note, hearty congratulations on your great achievement.
Thank you, sir. Thank you so much.
Okay, so just let me know, the result was just announced. The feeling after you saw rank 14, what was the feeling?
I was so happy, sir. I don't have words to express. I was happy and so gratitude, actually. I felt so grateful, especially to my parents and my in-laws, because they were busy looking after my baby so that I can study. And also my husband and my sister, they were my constant motivators.
Yeah.
And
so,
I feel.
Yeah. All right. Okay. So I still remember a couple of days back, Remya actually messaged me also that she was feeling a bit tensed that the results are coming, and she wanted a definite top rank. She worked exceedingly well for that. And I'm very happy that you got such a wonderful rank 14. All right.
Thank you, sir.
So Remya, to begin with, I'm sure Ramu, your husband, is also very happy. So yeah. All right. So I hope you're at your husband's house right now, right?
Yeah. Yes, sir. Yes.
Okay. All right. So Remya, first of all, definitely the viewers would want to know from you regarding the exam pattern this time, because this is a new pattern exam, the medical group exam. So entirely new pattern. Will it be clinical? Will it be factual? There were a lot of uncertainties. So first of all, can you briefly tell the viewers about how was the question pattern this time?
The question pattern, actually, this feeling of uncertainty was there even with me throughout my preparation period, and I know that will be the same for every individual. And it's like actually the exam pattern was, we have 150 questions, and I don't think half of the questions were clinical oriented, but then though the questions were lengthy, the concept they focused was very more or less simple, at least for some questions. But then the other 50%, I think there was more of actual questions, and that too those questions like the numbers and all, which we usually do not expect in such an exam. Such questions were also there. And overall, some 25, I think there were even questions, at least about 25 to 30 questions were very simple also. Even at a UG level, questions were also there. Such a level of one-liners were also there. But then in the other extreme, we have some 25, 30 questions. I think it was actually from the, I think maybe from the super specialty books or more genetics based questions where we don't expect such number of questions. Usually we don't see such questions, I feel.
All right. So basically summarizing to the viewers, see, this time in the medical group, there was a lot of uncertainties. Finally, the question paper was a mix of questions. Yes, there were clinical questions, but there was definitely a higher percentage of factual questions as well. Well, in all my sessions, I had told the candidates preparing also, you cannot take anything for granted with the national board. The previous exam, that is the previous NEET exam, was very much clinical. So many students were thinking, okay, so this will be definitely too much clinical. But I always mentioned this fact that you expect anything and everything.
Yes,
so yes. It was like that. So much of factual questions came. Maybe the next paper might be clinical. So I think Remya as a topper is trying to convey to all of you, please prepare for a range of questions and not just clinical alone or factual alone. You should have a good spread. As she said, yes, there were some simple, straightforward questions, even at say the NEET PG entrance level, but there were certain questions which were from the super specialty textbooks. So I personally also don't think that see, do not think all questions will come from Harrison. Definitely there were questions outside Harrison as well. Correct, Remya? Questions outside
Yes, sir,
Harrison?
yes.
Yeah.
Definitely.
There,
That is
there, there
like
were,
you said, last time I wrote actually nephro and endocrinology, last NEET tests I wrote. And
okay.
I think endo as well as nephro, out of 60, 50 questions were clinical.
Okay.
Only very few questions were straightforward or factual questions. But
Okay.
then, so I too had a feeling that maybe more or less more of clinical questions this time also. But then you have always said in your videos, especially your last video and all, you always, you stressed on the fact that always expect a wide range. So that was a surprise paper actually, this much of factual questions.
Okay. So, Remya, in the later part of the preparation, this towards the exam, we had conducted a quick revision program because we know the subject is very vast, and often candidates say revising towards the end part is the most difficult one. So how did you find the quick revision program of DocTutorials?
Sir, it's like actually during the early part of August, I think I was frustrated like anything, because I have my preparation, I have my notes, my videos, everything is there. I don't know how to, and there were certain portions I was marking in the Harrison only. So I don't know how to summarize all these or to have a quick revision towards the end. But then when actually this QRP videos were the most helpful one. Initial, it's like we have, I think 3 days, we will have a period of 3 days to prepare. 3 days means towards after 3 days we have that particular subject, we have MCQ based test on based on that subject. And with this 3 days, my plan was I have, before watching the QRP, I should at least have a quick revision through whatever material I have, so that I can add on what the faculty is saying extra. So almost for all the subjects I was able to maintain that order. And towards the end of the 3 days, I think we had an MCQ based test, and that was also very helpful. We had a rank also, the common rank list was also there, so that we can assess our position. And those, all of the QRP videos, all I have watched all the videos, and all the videos was exceptionally good, because there were many points I know, like I may not feel while my preparation time, I was not focusing on that areas. There was many such areas like that. So, but watching this, I could actually focus on that areas also.
Yeah, that is very important, because many times candidates would say, okay, we want to watch the lectures, but the time remaining is less, which is why we brought about this QRP idea of very concise, crisp lectures, because we know that towards the end, revising is a bit tough. So I think the QRP lectures definitely will help you revise in a short span of time. So maybe to candidates preparing for subsequent NEET tests and INI exams, what I would suggest is, start off with the main lectures, write your notes, keep revising, practice questions from the question bank, and then towards the end, definitely rely on the quick revision program, which is definitely beneficial. And Ramya, you were talking about the exam ranks as well. Can you just tell us, what were your last few exam ranks in the grand test, and was it similar to the actual rank you got?
Actually, for the subject test after the QRP, I think there were certain subjects I was there within 10. Okay. But then with the grand test, I think it was 1935, some below 50.
Okay, so 1935. So almost, you were scoring good, and so it's great that you could manage a rank of 14 as well. And I'm sure you're actually having a fingers crossed for endocrine as well in Trivandrum, yes. Right? So let's hope for that. Okay, all right. So 14 in this national level exam is an outstanding rank. And how did you find the Qbank and test series of DocTutorials as well? Did you go through the questions?
Yes, sir. I was not able to completely do all the questions, but then the fundamentals, we have two parts, one from the fundamental as well as the super specialty. I think the fundamentals actually, it would be very good if you can completely do all the fundamental questions at least. So those questions will always, it's like when you see a question, we'll remember it so long. rather than studying through the textbook, because there are certain subjects and all I was completely focusing on Harrison only. But then while I am reading Harrison, I may feel this is important. But then when it comes to questions, maybe those areas which I have skipped may be the important one. And I still remember, I think Villo nodular synovitis, there was a question. And we had a similar question. Actually, I have not read that in my revision or in any of my preparation, I have not seen. But the same question came in the exam. We had that question in the, question bank, and also in some of the test also, we had that same question.
Okay.
And the test series were also very good. Some of the test series, I think it's like more of a NESS pattern. So such a level may not be needed for NEET tests, but then yet it is unpredictable, I know. But then most of the tests were completely focused on Harrison only. So those both the question bank fundamental as well as the test were very useful.
And I would say for the future candidates, one very important message that we should learn from Remya is how she could actually handle this phase of preparation, because I know she has a baby, and I think the family was very supportive. So how much did that support mean to you? Because even before this interview, you said your child is in the other room, so you just sneaked into this room for the interview. So how was it handling motherhood and your preparation together?
Actually, sir, I was staying in my house for my preparation, and my baby is in my husband's house. And both my parents as well as my in-laws, especially my in-laws, were struggling with my baby. And actually, when I came here, I know I don't feel like leaving him here and going there for study. But then my mother-in-law was so supportive. Actually, she always advised me like, see, baby will grow, he will grow. It's your career. She was the one actually in the initial part. I don't even think of a super specialty. Also, I was like settling with medicine, but she was the one who motivated me. Actually, both my husband as well as myself. She was the one where she even advised me and even quarreled with me regarding studying for the super specialty. Yeah, but then she was
joining DocTutorials also. It was Ramu actually who first called me. So
yeah,
for the joining part, yeah.
Yes. Yeah. And she was taking care of my baby much more than I think how I will look. And when I come here to stay for some 2-3 days, I am completely I won't be able to study at least for 1 hour, because as I am staying away, he will be much demanding. He will always be with me only. But the last 1 month, and also my parents also will be frequently taking me there, right here again, going to Trivandrum, coming to Alappuzha. That was the way. And last 1 month, I was completely focused on study only.
Okay.
I was staying in Trivandrum only.
Yeah. And finally, Remya, what do you want to tell to your teachers at Government Medical College Trivandrum, where you did your MBBS, and Medical College Kottayam, where you did your MD? Because obviously, the backbone of your preparation or your knowledge level is the training that you have got from these colleges. In fact, I also know you from Trivandrum. I hope you remember the WAT classes that I took for you, when you were, say, third year or something at that time, right? Say your batch, in fact, I still remember many from your group. All right. So what do you want to tell all your teachers at these two colleges?
I'm so grateful to all my teachers, both Trivandrum as well as Kottayam, because I know even when I'm writing these questions, at least 3-4 questions I was able to write just based from my previous knowledge, or from the MBBS, or also from the MD, some lectures of my teachers. There were such sort of questions also. I'm so grateful to them also.
All right. So thanks a lot, Remya. It's an outstanding achievement of rank 14. And that too in an exam where there were a lot of uncertainties, but you held your nerves. And when such a tough exam comes, it's all about how you are actually committing yourself on the exam day with good presence of mind and seeing one question at a time. And Remya has shown us that with such consistent hard work, definitely anything is possible. So thanks a lot, Remya, and all the best. May you get the branch and the college that you deserve and you wish for. Thanks a lot. Bye-bye.
Thank you.
Okay. Bye.